Hi, everyone. My name is Giza Lopez, and I am the Executive Director of the New York State Youth Justice Institute. Greetings from DC, where I am attending the National Coalition for Juvenile Justice Conference. It's great to be here and to share space with you virtually. I want to start us off with a note of gratitude. Thanks to our partner at the CJS, the JJAG, UAlbany, and other agencies and institutions throughout New York. Thanks to Kierland Joseph with the Queen's Defenders and Cecilia Williams with the New York City Law Department for their collaboration on making today's training possible. Thanks to all of the Lunch and Learn presenters who have made this training a success. And above all, thank you very, very much to each of you who are here in the audience today, and to those who have been following our Lunch and Learn series since we started it in March 2020. Our training today marks our 50th webinar. It's a huge milestone for us at the YJI. Our very first Lunch and Learn was scheduled to be in person that same week when the WHO declared COVID-19 a global pandemic. The world shut down, the YJI pivoted. We moved the series online. Mind you, Zoom wasn't a thing yet back then, and we have remained here in this virtual space where our series thrived. I am proud to share that we have trained thousands of individuals through this Lunch and Learn series. They've joined us from over 30 states and from more than 10 countries. As we look back and reflect on the series journey, we thought it would be fitting to mark this milestone by sharing insights and lessons from the COVID-19 pandemic on the health and wellness of justice-involved youth. We are so very lucky to have Professor Heather Butts present her research on this topic, and to have the Deputy Chief Administrative Judge for Justice Initiatives, the Honorable Edwina Richardson, to moderate the conversation. Judge, we're humbled and honored by your presence and by your continued support, your mentorship, and all of that. Thank you. To wrap things up, Dr. Alicia May from the YJI will grace us with a cameo and a few announcements at the end of the training. With that, I will now turn it over to Professor Butts. Heather, the floor is yours. Thank you again.
Great. Hi, everybody. How are you? So it's a pleasure to be here. I'm really honored to be part of this celebration and this beautiful, amazing milestone. And I want to thank all of my friends at Queen's Defenders for making this possible, as well as everybody here today. It's been an incredible journey. And to be able to be part of this has been really monumental. So thank you everybody. YJI, you've been really fabulous to work with and true professionals. So I'm excited. So let's get started. What I'm going to do is we're basically gonna take you back in time. Some of you may not want to go back, but but go back we will. So we're gonna go back in time and we're gonna talk about the early days of COVID. It's really important to be able to think about what was happening February, March of 2020 because it gives you an idea of how we got to where we are now with some of these issues with court involved youth, youth in general, families, guardians, and the like. And I'm really excited because we're going to have a chance to have a real dialogue with the Honorable Judge Richardson. And I think we'll be able to dive into some of more of these issues as we plug along. So, you've gotten the introduction about me in the chat, so I'm not going to belabor where I am from and my journey, except to say that at heart, I am really a education academic. So I'm very interested in the way that people learn, how we learn, what that looks like, and the history of that. I actually did a book several years ago about Black surgeons during the Civil War, and why I was so interested in the topic was because it was something that lots of people didn't know about. And so the ability for us to learn from what we've seen in the past which now the beginning of COVID, as we mentioned 5 years ago, we're getting to a point where we're talking about it somewhat historically. That's the way that we're going to be able to progress forward with some of these issues. So the first thing I'd like you to do is to answer this question. There's no right or wrong answer, by the way. So you cannot be wrong. You can only be right. What do you believe are the biggest challenges facing youth 5 years after the COVID-19 lockdown? So I'll give you 30 seconds to be able to put that in the chat, just what your thoughts are about that. And while you're doing that, I'm going to talk about some of the challenges that faced us early in COVID. So, as I mentioned, I think it's important to think about where we were, where we've come from, and then we'll talk about where we are heading essentially. I can't help myself, and I'm looking at some of the answers in the chat. Socialization in person, anxiety, isolation, mental health. Wow, it's like you were all part of creating the presentation. How did you know what we were going to talk about? Very good, everybody. Right, right. Group norms, lost isolation, social skills suffered. All of these are the topics we're going to talk about. You're absolutely right. These are the heart of what was going on with people during COVID. By the way, we're also going to talk about some positives. That's not much we talk about during COVID. We focus very much on all of the things that went very wrong for COVID. There are some people that got a little break from life. One of the things I say a lot is, we think about 2019, and I think we have this sort of fantasy land thought about it that everybody was living their best lives in 2018 and 2019. There were some people that were suffering. There were a lot of people that were suffering during that time period. And so for some people, COVID and the lockdown was a little bit of a break for that. And so we'll talk about what happened with those individuals and what that looked like for them. Okay, so uh social distancing. I know who don't really want to think about that again, but there was a time when that was all we were talking about. Remember when we talked about social distancing and uh, you know, why it was so important. And when COVID first broke, and we were all pretty much unaware of what COVID meant and the implications, why social distancing was so important was because it risked the chance of infection to high risk populations. It slowed down the possibility of outbreaks. It flattened the curve. That was a term that we used to use a lot, flattening the curve and what that looked like. Also, when we think about terms, quarantine versus isolation, quarantine is people whose movement was restricted and they were exposed to a contagion, but they don't have the disease. Isolation is when you actively have the disease. What did that mean for people to be quarantined versus isolated? Outbreaks, epidemics, pandemics. Outbreak is the disease, an increase in disease in a localized area. Epidemic is a broader reach. Pandemic, global. You have to have multiple countries, two or more continents. These are all terms that we sort of got to know, and then over time they just became more and more prevalent. So this is what flattening the curve was for us back in 2020, 2021. The number of people that are sick can be the same. So if you have 100 people that are sick, but they're sick over 4 months versus 100 people sick and they're sick over 2 days, that's going to make a huge difference in terms of the penetrance of the disease and how many other people are going to become ill. And that was one of the reasons why it was so important in the early days of COVID to flatten the curve, particularly as we think, and we're going to get into it, about court involved youth and youth in general, why that's so important for that population. Early in the COVID pandemic, the weekly number of deaths, the little plus signs are the number of deaths over what was anticipated for that week at that time. And you can see once we got to late March, early April 2020, the pluses don't stop. They just continued on. So that's what we were looking at in terms of deaths for COVID during that time. Vulnerable populations and the trust gap. So huge trust gap for vulnerable populations, Black and Latino communities. That existed before COVID. The trust gap didn't just evolve in March of 2020, it was already there. COVID just made it worse. It exacerbated it, and then it stayed with us. So the coronavirus vaccines face trust gap, that's because the trust gap was already there for the medical community, for the public health community, and it just exacerbated itself. These are some definitions, and we're going to go over them as this goes on, but I just want you to get a sense of what we're going to be looking at. And then this is a quote that I utilize pretty frequently, which is, what is a successful virus? Um, and I think one needs to remember that a successful virus is not something that necessarily kills millions of people. The most successful virus that I can think of in modern times is chickenpox, right? Herpes zoster. Chickenpox is something that, well, not anymore really, but back in the day, it used to be a disease that children would get, and then it lies dormant along the spinal column in your body. And then if you're not so lucky and maybe you haven't gotten the shingles vaccine, when you get to be a little older, boom, there it is again. So chickenpox is a good example of a virus that basically just lives with you. It just hangs out in your body. You might get shingles at a later point, you might not. But a virus doesn't have a really vested interest necessarily in killing its host, because that leads to its demise. What a virus has a vested interest in is becoming better at being a virus. That's what it wants to do. And we saw that, and we see that pretty exquisitely with COVID, which, we have a burgeoning variant happening now. So COVID still remains with us. It's just that it is learning to adapt to us, we are learning to adapt to it. Jacobson v. Massachusetts. So this is a Supreme Court case from 1905. It's probably the most important public health case, period, full stop. It involves a man named, shockingly, Jacobson. Cases are they're pretty easy, right? It's not tricky. If it says Jacobson, there's probably somebody involved in the case named Jacobson. I'm looking at Judge Richardson because, if you know, you know. So, and Massachusetts, so probably Massachusetts involved. So this case involved someone named Henning Jacobson, and an ordinance in Cambridge, Massachusetts, that required that everybody who lived in Cambridge get the smallpox vaccination or face a fine of $5 and or face jail time. So the deep question in Jacobson is this permissible? This is a favorite word I hear people using a lot these days. Is it constitutional? Right? Is it constitutional to do this? Um, and the Supreme Court answered in the affirmative. Yes, a locality, a state can enact an ordinance to safeguard lots and lots of people, even though the civil liberties, the rights of some people might be infringed upon. And this is called police power, which has nothing to do with NYPD or PD or Albany PD. No PD involved here. But it has to do with the ability of a governmental entity, a state governmental actor, not federal, the ability to be able to enact public health laws that will safeguard people. And we saw lots of this in COVID. And we're going to talk about that a little bit more. But this right to privacy, civil liberties, some of these tensions that we saw during COVID, um, that is what we saw in Jacobson, a case that is 120 years old, but it rings true and very relevant today as it did in 1905. And so when we think about some of these civil liberty issues that we're going to talk about over the next few minutes, Jacobson is the case that we really have to keep in mind when we think about these. So if people don't agree to compulsory isolation, what can be done? Lots of things can be done. Um, as we think about how diseases are transmitted and what this looks like, there can be circumstances where we want to make sure that people are safeguarded, and the government can come in and make sure that that happens. All right, so this leads to challenges. Mental health outcome for youth and those that work with them, So you're gonna see some scholarly articles. I can't help myself. I'm an academic. It's just the way I roll. So I'm gonna have several scholarly articles that talk about some of the research that's being done, and then I have some research that I did with some colleagues at LIU um, around personality and what this looks like, which has implications for youth as well, because as we know, personalities of youth are not fully formed, but anybody that's worked with youth or had a lot of time with them knows that there are distinct personalities that young people exhibit at all ages. And so you can see the seeds of that developing. And so the personality research that we did has import for young people as well. So this has to do with youth experiencing homelessness during COVID-19, unique needs, practical strategies from an international perspective. The the hardships that young people who were unhoused faced during COVID really can't be overemphasized. With the biggest one I'd like to point out being the bubble. Does everybody remember the bubble during COVID? The bubble was that group of people that you were supposed to find, and then that was your crew, right? You stayed at home with them, you had meals together, you were in the bubble, right? And if somebody came from outside the bubble, I guess you're supposed to lock your door and and chain it and make sure they didn't get in the house. But the bubble was something we lived with for a while. Now imagine you're an unhoused youth and maybe you're doing a little bit of couch surfing and you're going from home to home and you don't really have any place to live. Well, during the bubble, none of that was happening. So, one of the things that we need to really sort of think about future orienting is for young people who are court involved or who are unhoused or who have unstable housing. What do pandemics like COVID look like for them? And I can tell you, it doesn't look good. So, youth experiences of unhoused youth, of homeless, running away, being thrown out, rough sleeping, staying in a shelter, couch surfing, youth who have left home unaccompanied by adults. Um, all of these parts are the normal ecosystem of a young person who is unhoused, but during COVID, a lot of this was not available to them. So couch surfing really wasn't available. Staying in shelters was sort of dicey. The ability to be able to have a roof over your head, again, very problematic during COVID. And so for young people who were already at risk, COVID exacerbated a lot of these issues a lot. Obviously, then the mental health issues that go along with that get exacerbated. Challenges of COVID and court involved underserved youth. Where are services often provided for these young people? They're in congregate settings. So, to get your food, to get your medicine, to get your supplies, you're going to go to a place, right? You're going to go to a church. You're going to go to where your probation officer tells you to go. There's a place you're actually physically going. But for social distancing, this is made difficult, right? Mental health issues associated with lack of stable housing. This is going to be made more difficult if you are couch surfing, if you're looking for a place to stay. Comorbidity of illnesses and COVID. So if you are a young person and you are court involved or you are unhoused or you are somehow otherwise underserved, you may already have illnesses that will be comorbid with COVID, which will make for a more problematic medical public health picture for you. Hygiene issues. So remember during COVID, the big thing, what was the big thing? Hand sanitizer, right? Have your hand sanitizer, wash your hands and then hand sanitizer. Hand sanitizer, wash your hands, do some more hand sanitizer. It was like a hand sanitizer sandwich, right? But if you're having a hard time getting basic hygiene down, you're probably not roaming the earth with, a gallon pack of hand sanitizer. So you already have hygiene issues. This is exacerbated by COVID. So you really don't have any place to be able to wash your hands on a regular basis. This puts you in a prime space for, wait for it, getting COVID. So these are some of the many challenges, and during the Q&A and discussion, we'll talk about them more, that are faced by young people who don't have services that they can easily access, already have mental health issues, have some comorbidities, already have hygiene issues. It's all was exacerbated by COVID. Poor physical health, racial inequalities, continued financial strain. All of this is going to be for these youth that are already in a high risk area, sexually transmitted disease, high risk behavior, difficulty accessing COVID treatment or accessing vaccination sites. So this is the transportation issue. If you don't have a way to get to the site where you can get the COVID vaccination, where you can get hand sanitizer, you just can't get there, then you're not going to get what you need, which goes back to where services provided. They're provided in places where oftentimes you might need to be able to get on a subway or two to get there. You might need to get into a car to get there. And so that's going to be foregone for some of these young people. And then, as I mentioned, we talked about the bubble and what that's like for young people, closure of schools, colleges, for a lot of young people, not having access to these other, areas that they could congregate, will make getting these additional services even more difficult. And then we have to think about the staff that services these youth, right? So staff needed to have the latest information on COVID. Were they getting that? Face-to-face interactions with clients had to be minimized. There are ways that this was, and we're going to talk about this in the Q&A, ways that this was attempted to be made up through Zoom, through Skype, through conference calls. Did it succeed? In some cases it did, in some cases it didn't. What if the staff becomes ill, right? We're assuming that the staff are all healthy, they're not getting COVID. What about when they get ill? Then what do we do? And then coping mechanisms for the staff themselves, stressors, difficulties, and so forth. This just goes into what stress can do to us, including fear, sadness, chronic diseases, and so forth. I'm going to speed along because I've got about 5 or 6 minutes left before we need to go to the Q&A. So I'm gonna move it along here. Um, and as we think about mental health in depth, some of the things that you all mentioned, you didn't need me to say it to you: anxiety, ADHD, disruptive behavioral disorder. These can all be exacerbated over time, and they can be very challenging for people. Post-traumatic stress, this is an area that I've spent some of my research and life work on. And for court-involved youth and other youth that are already traumatized, extra trauma from something like COVID can lead to re-traumatization and re-experiencing of what they've already experienced, which, as we've already mentioned, since there was a lack of services and difficulty for a lot of these young people to be able to access them, it leads to more trauma because now you're traumatized by the fact that you can't get access to services. You don't have the usual support system that you already did. You're trying to figure out where you're going to sleep tonight because there's a bubble and you can't couch surf. These things linger. So it's not like the light switch went on once we got through the lockdown and then all of a sudden everything was better. Things were worse. They were worse. And so that is what we're seeing in some of the, behavioral issues, some of the other issues that we're seeing is because it didn't get better because the lockdown ended. In fact, if anything, the ramp up to get people back to services just continued to make things worse. These are coping mechanisms during COVID: overeating, distracting behavior, alcohol use, drug use. This applies to young people as well as adults. So figure that the adults are engaging in some of this behavior as well, and so it makes it very difficult for them to support youth. You're going to see a bunch of charts from me about anxiety reporting. This one is just stunning. This is from 2021, and this is adults reporting symptoms of anxiety disorder. You look at the number from Mississippi. Adults reporting symptoms of anxiety or depressive disorder, 43.3%. And that's, remember, these numbers are now a year into COVID. So the numbers, it's hard to get numbers right at COVID, but the numbers become even higher um, right at the beginning of COVID. So Just think about that for a moment. Um, these are some more numbers looking at indicators of anxiety or depression based on reported frequency of symptoms in a 7 year uh, period. This is May through March of 2020 through 2021. And you can see the numbers are very high in the high 20s to low 40 percentile of people self-reporting during the last 7 days. And this frequency of anxiety and depression, these are, again, early days of COVID. You see very high numbers in the Northeast states, Massachusetts, New York, Connecticut, indicating again this is self-reporting, and clearly you would have people that are not reporting that would also have these numbers. These also just go into more issues regarding who's reporting, what that looks like, with women and children reporting more in terms of anxiety and depressive disorder, but you're not capturing everybody. So there are people who are not reporting and people that are not being captured. Some of this too is self-selection because people will feel more comfortable to report than others. But there's whole swaths of people that are not being captured. This is one of many publications that I could have selected regarding vulnerable youth and COVID-19 pandemic. And these go into pretty exhaustive detail regarding behavioral health services, experiences for underserved youth and unhoused youth during COVID, ability to get access to some of this, which, as we have mentioned, was very difficult. And then impact of COVID-19 on youth mental health. And I have uh, a pretty exhaustive list of references at the end of this, which I'm happy to share with anybody. This is a really interesting study that looks at the COVID impact for youth mental health. It's basically a mixed method study. And I know this is a little fuzzy, but I wanted to put it in here because it talks about both what I mentioned earlier, both positive and negative impact. So the negative is what we focus in a lot on, and it's what everybody mentioned: interpersonal tension, isolation, worsening mental health. Some people reported positives. So positive was they connected more with some people. So if you were in the bubble and you haven't talked with mom for 6 months because you're out and about, okay, maybe you connected more with them. Breathing room, relationship with self, got a little space, self-reflection, improved mental health and well-being. So, and we'll talk about this a little bit during the Q&A. People's personalities plays a huge role in this, and what people experienced during COVID it had an impact on how they experienced COVID because of their personality. But the negative impacts seem to far outweigh the positive. So for everybody that had a breathing room for 2 minutes, you had another like 800 minutes of, I can't believe I'm still in this. I can't believe I'm still on lockdown. So we'll get into that. And then the impact of COVID-19, the city bar, as always, just doing what the city bar does and doing great reports and great work. So this is a report, the impact of COVID-19 on the New York City Family Court, recommendations on improving access to justice for litigants. And I have the recommendations in a separate recommendation section. Technology, 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 technology. That was one of the big things out of this report and a lot of reports. We assume everybody has one of these, right? Everybody's got an iPhone, or what are we now, 16, 15, whatever we're up to now. Everybody's got one of these, right? And they know how to use it and they have access to it. Everybody doesn't, right? And so to the extent that we make assumptions about what technology people have, what they know about it, how they can access it. Well, one of the things this report noted is that is a wrong assumption for us to be making. Yeah, technology, technology, technology. The Barr report actually does a beautiful job of doing an exhaustive timeline regarding what litigants faced during COVID, what this looked like in the family court system, and as I mentioned, one of the issues was technology. All right, so this is our last two questions. Uh, please answer the following. Given what we've discussed about Big Five traits, which we've discussed very a little bit of it. But what do you think? Hold on, let's go to this slide first. This is my research. Yay! So then I'll go back to the question. So hold that question for a second. Personality predicts policy perception. Traits related to healthier behavior predict perception, and policy should be less stringent. Traits related to less healthy behavior predict perception, that policy should be more stringent. So this is the research I did with two amazing researchers, Michelle Dornish and Nancy Fry. And it asks what response, personality and policy perception, what responses are seen as appropriate for COVID-19. The part I want you to look at is this. So, our research showed that those in high neuroticism and conscientiousness thought policy should be less stringent than those with high neuroticism and low in conscientiousness. This can apply to youth as well. So, neuroticism is basically just people who kind of worry about things, right? I'm worried about this. I'm thinking about this. They just sort of, they're very nitty about, life. Conscientiousness, as you would assume, are people who they're very careful, right? They don't take chances. Those are the people that were out there wearing masks and making sure they got vaccinated and so forth. So, if I go back to the original question I had, given what we just discussed about these traits, why do you think our research would show that people who were high in neuroticism, meaning the people that were kind of worriers a little bit, and they were high in conscientiousness, so they're the ones wearing masks, they thought policies around COVID should be less stringent, and people high in neuroticism and low in conscientiousness, they're kind of like, live and let live, thought policies should be more stringent. Anybody have an idea about why that would be? I'll give you a minute to think about that. It's tricky, but it kind of gets us to, um, the heart of thinking about these issues, um, which goes to the last question, which has to do with, do you believe that people are different personality wise, or do you think we're all just basically the same? I think we could all sort of think about what that answer would be. But the reason why that is because we will say that we think people are different. So, oh, John Rice, I'm see what you did. I just see what you did there. Okay. First group is doing things to take care of themselves and don't need others to take control. You're basically at the answer. So basically, I most of us will say, "Oh, yes, I think people are wildly different and I know that people have different personalities and I understand that." But when we get to it, we actually filter the world through how we behave. So if I'm wearing a mask all the time and I'm getting vaccinated, I'm like, you know what? I'm going to do what I'm going to do. And other people, um, you know, let's see what they do, right? So if if I'm being very conscious about how I should be, then I'm thinking other people will be that way. Conversely, if I'm kind of a little loosey goosey in life and I'm not really wearing masks, I'm thinking to myself, ooh. Or if other people are like me, I think we need to have some more rules around here. This is not the way things should be. So even though we think people are very different, are they? Yes. Do we really believe that? Mm. All right, I'm going to finish up so we can get to our questions. These are recommendations. So a lot of them we've already talked about. Telehealth, we're seeing that happen. We need more of it. Complacency, compliance, confidence. This is why we have vaccine hesitancy. And I'll talk about this more when we get to the Q&A. And so thinking about how can we sort of deal with this more. And then the last thing I want to get to are solutions for youth. So this is what I was talking about before. Technology, do people have access to it? Are people in the courts updated? Do they understand what they need to be doing? Are they cognizant? And have they been trained? And this just goes to some of the issues that we think about in terms of we as a group, as a country, as a state, how are we supporting each other to make sure that we have what we need. And this is my exhaustive list of references. So I'm going to stop sharing there. I'm going to try to stop sharing. And I would love to talk with the Honorable Judge Richardson. And I thank you for your comments, which I'm looking at now. And I will try not to get too distracted, but I do want to read what people are saying, which I see what some of you said. And yeah, you're right. What you're saying is on point. So, hello, Judge Richardson. How are you?
Hello, Professor Butts. Thank you so very much for that really informative presentation. You started us off well, and I am eager to jump into the questions after I say thank you to everyone who participated in organizing this wonderful event for us. So, my first question for you, Professor, can you discuss the impact of the lack of face to face interaction with the professionals, the judges, the lawyers, the probation officers, others in court, our social workers, that impact of the lack of face to face on our young people during COVID? And is there anything beyond what you've already told us that we can utilize to mitigate this?
Yeah, I love this question. So I think the issue with COVID wasn't so much. Well, it was the lack of face to face was a problem, but then also we didn't do a good job just generally sort of mitigating that, right? So I'm a professor, I teach in class, I'm in a classroom all the time. So there are certain people who, and again, so the audience can ask themselves this question, right? There's certain people who, when we went to sort of a remote system and people worked from home 2 or 3 days a week, or some people have never gone back to work, they loved it. They loved it. There are people who like they never want to see the inside of an office or a school or any of that ever again. They're done. Other people, it was really, really challenging. Part of it has to do with personality, and we could talk. I mean, I could talk for hours about, our introverted friends, our extroverted friends, people who, some of what we talked about before. But it's not so much if you don't have the face to face time, if you can mitigate that and you can add something that gives people what they need, you can sort of get by. But as I mentioned before, when we went to this lockdown world, things just stopped. So courts stopped. uh the DMV closed. I was reading this report about how when the DMVs finally opened in New Jersey, there were lines, from like Princeton to Edison for people trying to get into the DMV because so many people just couldn't access services. So with the inability to access services, you have an unfortunate situation where people don't get what they need. Court proceedings are not happening. People just don't have any information. And it's not only that things shut down, but they shut down in a way so that people weren't being informed of what was going to happen next. Is my court proceeding going to happen next week, next year, next 10 years? Don't really know. And so I would say that's something that we are still dealing with in the recovery era. Uh, and I would also say that to the extent that we learn from some of this in terms of having services available for people so that they can get access to Zoom. Everybody does not have Zoom. Everybody doesn't have unlimited Zoom or Zoom that doesn't, end after 40 minutes. Was this provided for people, or was it assumed that people would just be able to get on these Zoom sessions with people and have sessions with their uh, lawyer, with their attorney, with the court? So all of that is a learning process. Some of these are not going to go away. So we still have court proceedings that are via Zoom. Have we learned? I'm sure as a judge, you probably see scenarios where people are still, oh, where's the Zoom button? And I I can't figure out how to turn off the audio and so forth. I had this sort of thought of having sort of a massive tutorials for people. We can really train people around how to use this and what that looks like. Have we gotten there? No, we have not. Do we need to? Yes, we do.
So Thank you for that answer. And I'm nodding because one of my areas of responsibility is access to justice for the New York State court system. And I will tell you that these issues that you have raised are still on the radar of our court leaders. And we have committees that are working very, very hard to promote access, including virtual access, because we talking about the positives and benefits, we have learned that there are some people and some processes where our communities benefit from remote access, but we have to make sure that it's equitable and explained to everyone and available to all. So
And
thank you
I
for
just
that.
add one more thing, privacy, right? So if you're at
Yeah.
the local shopping stop or you're, at the local Best Buy doing your proceeding, that's not optimal, right? So you can't stay in your
Absolutely
house
right.
for whatever reasons. It could be safety reasons, it could be it's too noisy. So you're out in the middle of the street trying to do the proceeding, and that's what you're doing. So also, have we really thought through, are there places that courts could set up that are havens for people? Now that we're open again, there's no reason why we can't have these spaces where one could say, okay, come to the court and go to this specific room and utilize it, which I think some courts do. I know some courts do, but we could have more of that. But, it's not optimal for somebody to, be in the middle of Central Park trying to conduct their court proceeding. That's not privacy. It's not equitable. And it's not the way we should want to have things run.
You're absolutely right. And our court policy is that every courthouse should have that available space for
Mhm.
folks who need it. Even if it's a virtual proceeding, there should be space in a courthouse or one of our virtual court access networks that we are opening throughout the state of New York for folks to be able to participate fully in their
Right,
proceedings. So that's
right,
an excellent point.
yes.
So my next question for you is, what are, if any, the cultural barriers that related to young people in terms of trust within the healthcare system? And that also includes the mental health care system as well as medical care. And what should people who are working with teens be aware of? And have there been any changes in this space since the pandemic?
Yep. So, I mean, the biggest cultural barrier I always come to is language. So, language in terms of, are there enough interpreters around? I mean, I actually give credit to the court system because the court system, unlike some other systems, is very cognizant of the fact that that is a need. Is it always available for all the languages that are needed? We could talk about that, but the awareness is there. So language is huge. Uh, Also just generational divides, right? In terms of, I mean, if anybody sort of talked to a 15-year-old recently, I mean, I understand some of what they're saying. I don't understand all of what they're saying. So there's the divide of the lingo that we use, right? Which is it can be different, right? So there's that. There's also, as you mentioned, different cultures, and I mean, I've done some research on this, and I would love to do more in terms of epigenetics and um, generational trauma. That's real. So, what a family experiences in their household over decades, over time, over generations, um, can be transported to family members, to young people. And you can have a cycle whereby the grandmother experienced something horrible in the medical field and the public health world, and that seeps into the ethos of the family. And now you have a 14-year-old that reasons that no one can really explain is very reticent to be engaged with the court system, to be engaged with police officers, to be engaged with mental health workers. And some of that has its roots in what the young person has experienced. Some of it has its roots in what family members have experienced. So the ability to be able to parse that through, and again, that's why some of this requires a real effort on the part of um, the provider, the court involved individuals, judges. I don't need to tell you this, because engagement with the family, if the family is available and receptive to this, can mean the difference between success because the young person has a support system and lack of success. So I would say that it's a journey, and also it takes a lot of people to be involved in this effort. And the more time that is put into uh being involved with the child, and whatever families are willing to avail themselves of this process, the better outcome one would have for the youth in that situation.
So you're recommending deeper engagement as
Yes,
well as awareness.
deeper
Okay.
engagement and awareness. Thank you. That was nice and pithy and to the point.
So on that same theme of distrust in healthcare and government among marginalized communities and populations, and strategies that we might be able to utilize to foster trust, any recommendations for the communities of marginalized populations to empower participation in the trust building process so long after the pandemic?
I mean, that's another great one. I would say the the very fact that you're asking that question is already ahead of the game, right? It's ahead of the process, because a lot of times we present things to communities as a fait accompli. Here you go. Here's a solution. Hope you enjoy it. A really basic example is, so in my nonprofit life, I run a nonprofit, and we have a project called the Clementine Collective that brings fresh fruits and vegetables to underserved populations in bodegas and corner stores. And, for the first couple of months, just we started in April of 2020. Go figure, right? So the first few months, we were basically giving people like what we could get access to. And then we said to ourselves, we should probably ask people like, what they actually want. And the answers we got were incredible. We had one stand, and they were basically like, why in the world are you not serving turnips? And I said, I don't know why we're not serving turnips. Let's get you some turnips. We got them some turnips, right? And now every holiday season in November, that stand gets turnips. But you don't know unless you ask. But the first thing you have to do is accept that you need to ask. And so I would say the asking is the first thing. Empowerment is huge. So having the young people involved in their own process is critical. The technology piece, I'm just going to keep coming back to that. So you have to have a way to talk to people. You have to have a way to be able to communicate with people. You have to have a way to get access to people. So all of these things, and also, how a young person is going to process that and what that's going to look like is going to be different for different young people. But the engagement, as you're referring to, is the first huge step. That's the big one, to acknowledge that there's agency, people have a voice. We want to hear from them. We legitimately want to hear from them. We want to know what they have to say, and then engaging them in the process. That's, I would say, the bulk of it. So engagement, to do the
So,
engagement.
but that's advice well beyond this topic. And so it's very, very important for us all to consider what you just said about that.
Right.
So you referenced in your presentation that COVID presented a rise in risk domains that contribute to homelessness and
Yes.
delinquencies such as mental health, substance use, and health. Can you elaborate on how interventions could be implemented to reduce these risks?
So there's lots of different things that can be done. I would say that one of the first things that needs to be done is so we have certain themes that are going on here, obviously in this talk. One is acknowledgement. Again, I think a big unfortunate issue with, I'm not even going to call it the post-COVID era, because we're still dealing with COVID. So let's not call it that. But this, post catastrophic COVID era is that if if you want to voice anything about COVID now, it is very difficult. So imagine being I mean, maybe this is not for like, a dinner event or somewhere, but imagine you're just somewhere with a friend. You're a teenager and you're with a friend, and you want to talk about that you were thinking about COVID lockdown, right? I mean, who's really going to engage in that conversation with you? who's really going to have that? And there's a thrust towards, let's not talk about that. Let's have a good time. Let's pretend like that didn't happen. The further we get away from COVID, and this is what I said, it's COVID is becoming very historical, but I don't mean that in a completely positive way. What I mean by that is we're talking about it as though it's this thing that happened a long time ago, and if you reference it, you're talking about history, but you're not talking about anything that has to do with current reality. I think we've got to let that go, because to the extent that we can acknowledge that there are young people and older people who are still, well, there are people suffering from long COVID. I mean, from a physical standpoint, there are people suffering from long COVID, but also from a mental health perspective, there are people who are still dealing with the ramifications of COVID, the trauma of COVID, losses that they suffered during COVID, losses that people they know suffered. Everybody in this country, in some way or another, was impacted negatively by COVID. So I would say the ability to be able to honestly have these conversations with people, whether it's someone that is close to you, whether or not it's someone in your court involved life, if that's the case, and to know that you can have these conversations in a meaningful way, in an empathetic way, that you're not going to be met with, that was 5 years ago. Why are we still talking about this? Why don't you just go have fun? So the denial of people's truth, the ability for them to speak their truth, uh, that is something that we really need to mitigate. That takes some training, right? And that takes some work. But I would say that it's well worth it for people to feel that there is a space for them to be able to have these conversations.
Wow. Well, that what you just said is powerful, because I think that we as people tend to avoid the difficult, and as you said, we were all in the same storm in COVID. None of us escaped being impacted, even though we were not all in the same boat. Some of us experienced it differently than
Right.
others. But what you're mentioning about allowing ourselves as professionals and others who are engaged to allow people to have the difficult conversations or the painful conversations without stifling it. Thank you for that. So I've learned. Thank
Like
you
you
for
said,
that.
that we were all in the same storm, but we weren't in the same boat. I think what some people are concerned about is they're going to hear about some story in some boat that they don't want to hear, right? It's like, oh my goodness. Well, I was in like a little boat and then I got to shore and I was fine. But that story, that brings me back and that's catastrophic. But I think we need to sit in that and say to ourselves, we might hear something from somebody that's a catastrophic story that we weren't prepared for. Uh, but with enough training, with enough readiness, we can get through it together, because we're all in the same storm. And I think it's becoming more and more difficult to sit in that, because it's painful.
Believe it or not, this is our last question.
Oh,
So I'm disappointed. I'm
yeah.
disappointed. But I'm going to ask you whether you are aware of any research that is telling us about developmental concerns for the cohort of children who were born during the pandemic babies, and now that they are entering school.
Yeah, so I have in my exhaustive list of 4 pages of resources, there is some information in there where, development, like personality, is a continuum, but a lot of things happen from 0 to 3. So uh we're starting to see some interesting information, not only about, in young people that were born, but also along the way of school age children, young people who were in college, people who missed out on graduations. So, I would say that we need to keep an eye on all of these pockets of individuals, because we will start to see some interesting developments, I think. And again, if we can learn, right? If we can learn from what we just went through, keep an eye on these individuals, do more research, big proponent of research, and make sure that we're gauging some of this, then I think we can get ahead of it. The problem is if we're having challenges, even having the conversations, like I mentioned, then it's difficult to say, oh, by the way, we should probably do some more research around that, or we should, look at what the literature says about this. So starting to see some interesting things. We should look more for it. And I think if we can sort of be able, as you said, to acknowledge we were all in the storm and how can we help each other who were in different places in it, then I think we can manage to get through.
So thank you so much, Professor. This has been a true delight for me.
Me too.
I want to give you the opportunity to say anything with the last few moments that we have that you want to highlight before we close today. And to those who are asking for materials, the resources will be made available to you.
Yeah, so I obviously was thrilled to be able to have this time with you. I could have talked with you for another several hours. I don't know if the participants would have wanted to stay here for all of that. It's a topic that is near and dear to me. I think it's exquisitely important. I hope that we all remember that there are young people out there that need our support today and every day. And we have to be vigilant in thinking about the ways to support them and be future oriented into the ways to support them for what's down the road that we can't even imagine. I mean, we can imagine lots of things, but we can't imagine, but we need to be prepared for that. And if COVID can teach us that lesson, then I think that we um, will have learned a valuable lesson from the last 5 years. And just again, thank you, YJA. Thank you, Honorable Judge Richardson. It's been a real honor and a delight.
All right. Well, thank you to you both for your presentation, for your conversation. And I join everybody in attendance today, thanking you both for what you've shared and for joining us for our milestone 50th Lunch and Learn webinar. So on behalf of all of us here, thank you once again. In a moment, we're going to launch a poll question for our audience to let us know about how much you agree or disagree with the statements this webinar was informative, this webinar was engaging. We're going to ask you to answer these questions so we can know how today's webinar went for you. And while everybody is answering that, we have a couple of announcements to put on your radars. So the Lunch and Learn is going to be on break for the summer months, but we will be returning this August. Please be sure to sign up for our newsletter and connect with us on Facebook, Instagram, and LinkedIn to get news related to our upcoming events. The links to those accounts can be found on our website and have been dropped in chat, I believe. Immediately following this webinar, a survey should appear in the browser window you used to join today's webinar. We ask that you please complete it because that allows you to provide further feedback to us and questions for us or for our speakers if we didn't get to your questions today. The information that you provide is used to improve future webinars, and it shouldn't take you any more than 5 minutes to complete. So that link again should also be in the chat. A reminder that the views expressed here are those of the presenters and do not necessarily reflect the views of the New York State Youth Justice Institute. And in closing, I want to thank you all for taking part in this session of the YGI's Lunch and Learn series. We hope that you've gained something valuable from this webinar and that you continue to think about what Professor Butts presented today. We look forward to seeing you at future YJI events. Thank you.